This is Case Conversations, special edition case in collaboration with the McKenzie Insitute USA, video number 2 of a 3-part series. The patient, Brian, a 44-year-old male with right knee pain. The assessing clinician, Scott Herbowy of Austin, Texas, USA. Our panel of guest experts for the question and answer session to follow is Dave Oliver, Cora Atona, Gary Dykes, and Scott Herbowy. I'm Jason Ward, and I'll be moderating this special edition Case Conversations patient case. Welcome to Case Conversations for this special edition case in collaboration with the McKenzie Insitute USA. Again, this is a 3-part patient case, including the initial examination and 2 follow-up sessions. Today's footage is the second of 3 videos. The third video will be released 1 week later from today's with live and recorded question and answer sessions with our panel of experts after each video. We invite you to obtain a McKenzie reassessment form and complete it as this reassessment is conducted. We would also encourage you to make note of any questions which you'd like to email to the panelists following part 2 for them to answer. Please send your questions to the email address caseconversationsmdt@gmail.com. So without any further delay, here's part 2 of this special edition case. Enjoy.
We thank you for coming back today, and the first thing we'd like to ask you is, have you been able to work on the exercise since 3 days ago?
Yes, I've been able to. Yes,
Okay, and overall, has the exercise had any effect on your knee? Do you think overall you're better, you're worse, or you're the same?
No, I think I'm better. I think I'm probably about 60, maybe 70% better.
Okay, and what makes you say that? What have you noticed that's different in the knee?
It doesn't feel like it did before. One thing I did notice is the first day I did it, that I had, it was like achy on the inside. Not my typical pain that I've been having, but like on the inside it was just achy. But today that ache, it doesn't feel achy like it did yesterday.
Okay, and as far as activities, have you had to go up and down stairs, or did you run in the past couple of days?
No, I didn't. I was a little apprehensive about trying to do that.
About trying to run,
yeah,
okay.
But going up and down the stairs seems to be a little bit easier now.
It seems easier, okay. And getting out of the car, you mentioned getting out of the car.
You know what? I forgot about that one. That's
okay.
I guess it didn't. I didn't notice it this morning, so I guess it's better.
Okay, good. Are you worse in any way, Brian, from what we've asked you to do?
No.
Okay, and you've been fairly regular. How often have you been able to do the exercise? I think we asked you about 5 or 6 times a day.
Yes, and you said about 15 times. Yes, so I've been able to do.
You've been able to keep up with that?
There's been a couple times that I think maybe I did it before. I guess I've done a little bit more just because I get so busy and I'm like, oh, I got to remember to do it. So,
right. Okay.
So I maybe done it a little bit more than probably what you recommended, but I haven't had any adverse.
All right, that's fine. And at the time you were doing the exercise, did you notice anything with the knee as far as pain? Did your usual pain get worse with the exercise, or did you have the pain during the exercise?
No, it seems to do. It seems to be doing okay.
All right, and that ache you talked about. Did that ache come on specifically with the exercise, or it just seemed to be overall it was kind of there?
I think with the exercise, just because I haven't had that. It hasn't had that feeling before, so that's the only thing I can attribute to.
But did it come on? Do you remember an instance where you were pushing on it and it started aching at that moment, or it was just kind of in general?
Yeah, I think in general.
Okay, very, very, very good. And today you don't have the ache?
No.
Okay, and do you have your usual pain at this moment?
No.
Okay, so we're going to go ahead and take a look at the knee again. So let's have you go ahead and lie down on your back.
Okay.
Okay, and I'm going to raise this up a little bit to make it level for us. Good. All right. Good. All right. So I think we had you lying the other days, the other way on the first day. So this is your knee that is not a problem. So we're going to have you bend that up as far as you can, and we're going to go ahead and push on it. Good. All right. And the same thing with this one, Brian. what happens there now?
Maybe just a little bit at that end, but nothing like it was before.
Nothing like it was before, so that's better than before. Okay, and we're going to look again at the straightening here. And there. And then the same thing here. Okay, and what happens there, Brian, when I'm pushing on it?
Doesn't feel like it did before. It actually feels just a little bit looser.
Feels looser than before. Okay, very good. All right, so we're going to ask you to go ahead and stand up.
Okay.
And again, facing toward the table, we're going to have you try that squat motion like you did before. So your feet are shoulders width apart. Now, before you go down, do you have any pain? Do you have the ache? Do you have anything like that?
No.
Okay, so let's have you go ahead and try that now.
Okay.
And compare that to the other day. Good.
Still a little bit, but you know, it's not as bad there. I still got, you know, it's further. I'm able to get down further before I have that.
Okay.
And I wouldn't call it that same amount of pain that I had. It's just, it feels like something's restricted.
Okay, so it's further into the range and it's not quite as painful.
No.
Okay, all right, good. And let's have you just sit back on here. And I know this isn't the exercise you did, but the first exercise we had you do the other day where you just straightened it and you had that pop. You had that pop with it. Let's go ahead and see if you're still getting that pop. So go ahead and squeeze, tighten real hard, and then go ahead and let go.
First one, it popped.
It popped? Okay. And again, the pop's not painful?
No.
Okay, did it pop on that one too? So the pop's pretty consistent?
Yeah.
Okay.
This one I come down right there.
Okay, all right. Very good. Okay, Brian, I'm going to have you go ahead and demonstrate the exercises you've been doing it. We want to see if we showed you the right way to do the exercise. Okay. And before you start, do you have any pain right now?
No.
Okay, go ahead and show us how you've been doing the exercise, please.
So you have me tighten, and then I push down just like that.
Good. And have you done any yet this morning?
Yes, I did 15 before I came.
Okay, so you did it not too long ago. So just go ahead and do a couple more repetitions for us here. Good. Good. And one more, please. Okay, very good. All right, Brian, I think we're on the right track here. So what we're going to do is we're going to progress the exercise today. We're going to make it a little bit more vigorous. Okay. And we'll see if you can get some further benefit from that. So I'm going to ask you to come up over to the wall here. And we're going to have you stand and lean against the wall so that you are balanced here. We're going to have you balance up on that leg and get full weight through there. And essentially it's going to be the same exercise where you straighten the knee and then above the knee push back toward the wall. Again, not pushing down on the kneecap toward your foot. So straighten the knee, push about 3 or 4 seconds and then let it go. Okay, so we'll have you right there. Okay, good.
So right here like this?
About like that, and lift the left leg up so you can get balance there. Good. And now go ahead and straighten the knee first. And now use the hands to push backwards.
Do I need to tighten this?
Yes, tighten the muscle, squeeze real hard, and now push back, and then let go. Now, did that cause any problem?
No, and even though I don't feel like the other day when I did that one, or when I pressed down, I could feel that. It wasn't too bad back there.
Okay,
strain, I guess.
But you still feel the strain back there, but you're not really having the pain?
Yeah.
Good. And I'm going to ask you to do 10 of those now. So you've got about 8 more of those to do. Real nice, firm push back and produce that strain on the back of the knee, Brian.
Okay.
Good. Very good. Now, if anything starts to happen, please let me know. Okay, why don't you do 2 more?
Okay.
Good. push back, push, 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 push. Good. All right. You all right?
Yeah, this is
A little fatigued. Okay, so we're going to have you come back and try that squat now. So facing toward the table and the feet is shoulders width apart, and down you go.
Oh yeah,
No.
Yeah.
What's happening there?
That's that same pain.
Okay,
Mhm.
that's worse than it was a little bit ago.
Yes,
Okay.
yes.
Is it hurting right now as you're standing there, or just when you did the squat?
Just when I did the squat.
Okay, but that's pretty limited.
Mhm.
Okay. Could we ask you to lie on your back again, and we'll
Okay.
check. Good. All right. And let's have you go ahead and bend this one up, Brian. Good. And now this one.
Yeah.
Oh.
Even when you start going into that bend right there, yeah, that hurts.
Okay,
right
so
there.
that's
Yes.
much worse than it was a
Yes.
little bit
Mhm.
ago. Okay. All right.
That was back to where it was.
You seem like you're back to square one now.
Mhm.
Okay.
Yeah, that's good.
All right, so let's check the straightening again.
Okay.
And I'm going to hold that down. And what happens there now, Brian?
It feels like it did before. It's like something's restricting or blocking it again.
Yeah, okay, so the motion feels stiffer than it did before.
Mhm.
Okay.
Yeah.
All right, and I'm just going to ask you again to do this one. And where is that pain, Brian? Is it the ache you described, or is it your usual pain?
Yeah, usual. Because
It's-
when I get to right there, as you go through that, yeah.
It's there?
Yeah.
Okay. All right. So let's go ahead, Brian, and have you come back into sitting.
Okay.
And let's see if we can kind of just get back to where we were before.
Okay.
By having you do the original exercise with the foot up on the
Okay.
there, and have you try about 10 of those, and
Okay.
let's see if we get this thing to settle down just a
Okay,
little
so
bit down.
tighten
So
again
there,
and-
tighten and then push. The same one you've been doing
Okay.
at home. Okay.
Gotcha.
Good. Are you having any pain with this not right now, Brian?
No.
Okay. Good. Remember to push straight back, not toward your foot. There you go. Good. And I'm going to ask you to do 2 more.
Okay.
And again. Okay. And we're going to ask you to stand and face toward the table. We'll check the squat again and see if we've made any change in that.
Okay. Yeah, that's better than what it was just a second ago. Still limited, but
Okay.
better.
Yeah, better than just a minute ago.
Mm-hmm.
Compare it to the first one we did this morning, though.
Yeah, first one did this morning was yeah, that was the best.
That was the best.
Mhm.
So it's better than the last one, but not as good as it was before.
Exactly.
Okay.
Yes.
And let's have you go ahead and lie on your back again.
Mhm.
Let's check that. It looks like bending seems to be the biggest problem here. So,
Mhm.
so now, any pain right now, Brian?
No.
Okay. So let's go ahead and bring
Yeah.
that up now.
Yeah, that's better right there. Still right about yeah. As I get right there,
Yeah.
it's better. It's not as earlier it was. Yeah, when you got to that point, that was really painful. Now it doesn't hurt as bad.
Yeah. But compared to the first one this morning.
Yeah, no, yeah. First one this morning is definitely the best.
Yeah. Okay. We're going to have you stand again, Brian. We're going to have you do a few more of these on the table.
Okay. On the chair.
Yeah, with your foot up on the
Okay.
heel.
Okay. Oops, I'm sorry.
No problem.
Tighten.
Tighten and push down. Good. And push down. And push down.
That's 8.
Okay. And 2 more then.
9. 10.
Okay, very good, Brian. We'll push that out of the way and go ahead and have you stand again.
Okay.
And we're going to have you do the squat. We're going to have you do the squat again, so your feet apart, and then down you go.
Yeah.
Okay. Is that any different than the last one?
No, same.
It seems to be about the same as the last one. Not as bad as the worst one, but
No.
still not where we were when you first walked in the door
No.
today. Okay.
No.
All right, Brian. We're going to ask you to go ahead and lay on your back again.
Okay.
And we're going to try something a little bit different here.
Okay.
We're going to put a little twisting motion on your leg as you straighten it. So I'm going to have my hand underneath your knee, and you feel my 4 fingers there.
Yes.
Your part in this is to go ahead and push down into my 4 fingers like that.
Okay.
And you push real hard into my fingers like that.
Okay.
Now, as you're doing that, I'm going to be adding a little bit of a twist motion like that to the knee, okay? All right, so let me get myself set here, Brian. And good. And feel the hands there, the fingers there. Okay, we'll do one kind of gently like that.
Okay.
All right, now.
And then I'm tight. You said I'm pushing down.
Yeah, you feel more 4 fingers. Again, you push into my 4 fingers as strongly as you can. Okay, and I'm going to put my hand here, up just below your knee, and the 4 fingers are there. But you're going to feel me giving a twist motion down here on near your ankle. Okay, so let's do one like that. Good. Now, did that do anything, Brian? Did that cause any problem?
No.
Okay, so here we go. Push and push and push. Very good, Brian. Good. Any pain with that?
No.
And a couple more. Push. Good. And again. All right. Let's have you stand, Brian. And again, face toward the table. We're going to check that squat now.
Okay.
And see how that is.
All right.
So feet apart. And now down you go. Good.
It actually feels a little bit better.
Better than the last one we did. Are we back to where we were earlier this morning?
No.
Not quite?
No.
Okay, let's go ahead and try a few more.
Okay.
And good. So it's going to be the same thing.
Okay.
Let me get my hand positioned there. So again, you're going to be pushing down strongly into those 4 fingers.
Okay.
And I'm going to get my hand down here.
Okay.
And here we go, Brian. Push. Push. Good. Good. And a couple more, Brian. Come on. You causing any problem with this?
No.
Good. 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 And good. All right. And back up into standing, please.
Okay.
And, yep, we're going to check that squat again and see what we have.
Okay. That feels a little bit better there.
Okay.
Maybe we'll go down a little bit more. Still at the very end there, but not. It's almost getting back to where it was this morning.
Okay. So not quite there. Now let's. We're going to see if we can teach you how to do that exercise by yourself, Brian.
All right.
So, same position as you were before,
Okay.
when you were standing up against the wall. But first, I'd like to, when you stand, we're going to have you toe out a little bit with that foot. We're going to start with the knee bent, and you're going to place your hands toward the outside,
Okay.
squeeze slightly, and then turn your muscle toward the inside, then squeeze a bit more firmly and really turn that muscle. And as you keep it turned, Now we want you to extend it fully, and as you extend it, you're keeping the turn, but you're also pushing backwards like you did before. So essentially, we're adding this twist of the muscle to the exercise you did before.
Okay.
Okay, so right up, get yourself balanced against the wall, nice and firm.
Okay, you said turn the
Toe out a bit there.
Is that good right there?
Yeah, that looks pretty good. So you start with it bent. You're going to use both hands here, up on there. You're going to lightly squeeze. Now roll that tissue.
This way.
Now squeeze firmly with your hands and roll even more. And now straighten your knee, and as you straighten, you're going to push back. Good, and then release. And you can keep the twist on, so you don't have to put it on every time. So real firm twist, and straighten and push back. And bend a little bit. And now twist and straighten. Now we're going to make it a little more complicated by having to go up onto that one leg. So you're going to take this leg and put it up against the wall. You got your balance there.
Yes,
Okay, so real firm twist, Brian. And now straighten, fully straighten, and push backwards while you twist. Good, and then release. Yep, twist real firmly, and then straighten and push backwards. Very good. And let's have you try to do 6 or 8 more of those. Fully push. Good. And again. Good. And your concentration is on the twist and the push backwards. It's a pretty complicated exercise. And push. Now, are you having any pain with this, Brian?
No.
No. Okay, keep
We'll
going.
see when we're finished, though.
Yes. All right. Good. It is a difficult exercise. And push. Good. And why don't you give it 2 more, Brian? Good. And the last one, real firm, and squeeze that muscle and make it go backwards. Good. All right. You okay, Brian?
Mm-hmm. Yeah.
Okay, good. All right. You can walk it off a little bit and have you come on over. And you know what we're going to check? We're going to check that squat there again. So feet, shoulders width apart again. And let's see how you do on this one now.
Okay.
Good. Are you able to go any further?
That's about it right there, but that's now it seems like I'm back to where I was this morning.
Okay. All right.
Maybe a little bit better.
Maybe even better than this morning. Well, let's see if we can get it more better.
Okay.
I'm going to have you come over and try the exercise one more time.
All right.
All right.
This like this.
Like that, and you're going
And
to...
then rotate like that.
Yeah,
Okay.
yeah. And we'll have you toe out just a little bit further. There you go. Good. That's it.
Okay, let me make sure.
Make sure you got your balance.
Okay.
Good.
And then rotate it this a little bit there.
Good.
Okay.
Now remember, you're going to squeeze and turn that muscle, and now go ahead and straighten your knee and push backwards while you're twisting it. Good. And back up, and give it a big twist first, and now go ahead, and there you go, Brian. That looks good. Now, any pain with that?
No.
Okay. Do you feel any strain on the back of the knee like you did before with that exercise?
Yeah, a little bit of straight back.
Okay.
There.
We want you to try to get a lot of strain back there. So really push it.
Okay.
Good. Is that better on
Yes,
strain?
yes.
Yeah.
I had a
Okay.
little bit more pressure.
Okay. Really push into that so you really feel that strain on the back side of the knee.
Okay.
All the way. Good. Oh,
That's okay. I got you. Okay, let me do that one again.
good. Let's
Okay.
have you give it 3 or 4 more, Brian. If we find the right movement, the more you do, the better it'll be. Push, push, push. Good.
Hands slide over a little bit.
Okay, you getting a little tired?
Yeah, there you go.
Okay.
Plus
Good.
my hands were sliding over. a little
Okay,
bit,
all right, very good. So let's come on over and check that squat now.
Okay.
Okay.
Gotta kind of.
Yeah, you need to shake it out a little bit. Okay.
Yeah. Yeah, I'm still kind of coming over to the left a little bit, but that's better.
And what about the pain now?
Maybe just like deep inside, but nothing like, almost like an ache, like
Okay.
it was aching.
Okay, and how about the pain on the inside?
No.
You didn't get the pain on the inside that time?
No.
Okay, so let's check your motion lying down again, Brian. Good, all right, very good. And what happens with that?
No problem.
No problem there. Let's go ahead and do the bend now.
That's right about there.
Okay.
That doesn't bother me near as bad as
Okay,
it did earlier.
okay. And where do you feel that now? Is that the pain on the inside, or is that just that ache that you're,
Yeah, it's kind of that ache.
just kind of that
It's
ache?
still a little restricted, but it's nothing. Earlier, when you try to do that,
Yeah.
that wasn't good. But
Are we
now-
back to where you were when you walked in? Were you
Mhm.
better than that, worse than that?
Well, we're definitely back to where I was when I walked in. I'd say just probably a little bit better.
Okay, better. You don't think worse?
No, definitely not worse.
Definitely not worse. Okay, and can I have you sit on the edge of the table? We're going to check your strength again. We checked that on the first day, and I think on the first day, your bending strength was pretty good. You had that pain with the, so have you go ahead and scoot back onto the table, and we'll start you here and go ahead and bend backwards for me real hard. Come on, pull. Good. And now go ahead and push on me. Out.
Yeah.
And what happens there?
Maybe just a little bitty, but nothing like on the first day.
Okay,
Yeah.
very good. All right, Brian. So what we're going to change the exercise today. We're going to have you continue it 5 to 6 times a day. We'd like to do 15 repetitions, but we want you to do that last one we had you doing against the wall, where you go ahead and you twist that muscle first, and then you straighten it. Remember, we want you to start out in a toe-out position, and lift the other leg up against the wall so you have full weight bearing on that side. And about 15 repetitions of that about every 3 hours. Okay. Do you feel that you need to practice the exercise again, or you feel like you got it?
No, I think I got it.
You got it?
Yeah.
Okay,
Yeah.
very good.
Just toeing out and twist and push back.
Okay, so would you be able to come back and see us in about 4 or 5 days, Brian?
Yes.
Okay, very good. All right, thank you very much.
And there you have part 2 of the special edition patient case. We hope this follow-up assessment has been helpful for you and has stimulated some thoughts related to Scott's clinical reasoning to the extent that you have questions. We encourage you to send your questions and comments to our panel of experts, Dave Oliver, Cora Aitona, Gary Dykes, and Scott Herbowy, to the email address caseconversationsmdt@gmail.com. Within the next few days, in preparation for our follow-up question and answer session with our panelists, your questions will be reviewed and made ready to be addressed on that upcoming Q&A. Be sure to make note of that time for the question and answer session for those who would like to join us live. But if you're unable, you will receive a link for the recording following. On behalf of the Mechanical Care Forum and the McKenzie Insitute USA, thank you for your attention, and we look forward to being with you for part 3 and the second Q&A session shortly.